Hello, my name is Dr. Robert Parker. I'm a board-certified podiatric surgeon in Houston, Texas. I've been here for now 4 decades. I'm past president of the Southwest Division of American College of Foot and Ankle Surgery, co-founder of the Harris County Podiatric Residency Program, currently vice president and a co-founder of the Association of Extremity Nerve Surgeons. And if you're watching this film, you're wondering if that instrument that you're looking at is beneficial for your patients and for your practice. One of the things I'm primarily interested in my practice today are therapeutic lasers and how they affect different conditions that I treat for my patients. In laser therapy, or low-level laser treatments or low-level laser therapy, you may see LLLT as an abbreviation. Another term for it is photobiomodulation. I explain to the patients that everyone knows what photosynthesis is and how the sun rays go through a plant, keep it alive, and it does something inside of a plant. And in humans, we call it photobiomodulation. I got that term from a professor I was honored to meet, and he spoke at our nerve meeting in Vegas this last year. His name is Professor Michael Hamlin. Professor Hamlin is a professor at Harvard School of Medicine. And he has been studying the effects of laser on cells. He introduced me to a term called biphasic dose response. And that simply means that we know that low-level emittance of lasers is beneficial and healthy for tissue, and that higher levels is detrimental and it actually can kill tissues. For example, the high-level PDT or photodynamic therapy kills cancer cells, for example, in dermatology. This is one of the primary areas that he's been studying, and it's used in a multi-discipline fashion in the fact that they're treating it for spinal injuries and brain tumors and conditions of the sort. So let me just show you this cold laser. I'm going to put the glasses on. And this laser is unique. It has a battery pack here that you can charge 2 batteries, and makes it very mobile with the 3rd battery on the unit itself. This is called a Microlight 830 or ML830. 830 is 830 nanometer. Each of the 3 laser beams delivers a little over 3 joules of energy, totaling 9 joules, which is again a low level. And when you turn it on, as you know, you can't see laser. You may be able to through this film because laser beams can be seen if you turn a camera on. But the LED makes it possible so that you can see where you're treating. And you can probably hear that beeping noise emitting now. And I've treated in my office and with my patients conditions such as Achilles tendinosis, tendinitis, fasciitis, ankle sprains, postoperative edema, postoperative pain, neuropathy, particularly compression neuropathy, and the sort. This unit is very convenient, and I'll explain a few more things about this in just a second. So all my other lasers in the practice are hot lasers. In other words, they have to be administered and by a technician or myself, because they can be harmful to patients if they are used inappropriately. The ML830 is a cold laser, and patients cannot hurt themselves unless you were to take this beam and shine it directly into your eye, which you wouldn't do that even with a pointer laser. So we have 5 of these laser units in my practice today. This one stays in the practice and it's the one we use with our patients. We have 4 other lasers that we actually lease out to patients on a weekly basis. And we have a waiting list for patients wanting to use this form of treatment. So when patients do ask me about what these lasers do, I'll bring out this picture and discuss photobiomodulation. and also what the laser beams do. And we talk about, again, laser beams coming in as the sunlight does for our plant, but in the humans, we have ATP molecules, adenosine triphosphate, which is our primary energy source, as you know. Nitric oxide pathway having to do with our circulation and the modulation of the size of the vessels. Reactive oxygen species, which has to do with NF-kappa B transcription for gene transcriptions, which generates the growth factors, the cellular proliferation, cell motility for helping ulcers heal and helping wounds heal. So laser beams actually tell cells to do something, as opposed to, say, physical therapy, which simply increases circulation to the area. So the benefits from these lasers would be things as wound healing, tissue repair, prevention of cell death or apoptosis, anti-inflammation, pain relief, edema, acute injuries, chronic injuries, even neurogenic pain, as we discussed, which is one of my primary interests, and other neurological problems. So, as I see it, this instrument is almost like having a pharmacopoeia in a light beam. To patients, I call this a Star Wars type instrument. I'm looking forward to utilizing this instrument in many more different ways. Hopefully, it can help me with these nerve conditions. I'm doing a study right now with respect to using this instrument as a diagnostic tool and using this instrument for other treatments of nerve conditions. But for the general practice, I can see where physical therapists, chiropractors, podiatric physicians, orthopedic surgeons could use this, even family practitioners in their office. Thank you.